नहीं हाथ वाला नहीं है, डब्बी है उसकी सिर्फ।
क्या चीज़?
डब्बी है सिर्फ।
I apologize for the delay because there was some confusion about the venue. And so our venue was allotted to the Pakistan Pediatric Association group. So I think we should start now. We are already late. Let's go to our topic. Approach to non-specific aches and pains, fatigue, lethargy. And I especially chose this topic because these are something which we see in our general practice. Let me start my presentation with this picture. The very famous person also suffered from such a disease. Like Darwin was the founder of Darwin theory. He also suffered from such non-specific aches and pains, and he was limited to his bed in the last years of his life. So it's such a disease that can catch anybody at any time. All the things are non-specific. They do not tell us any information about the diagnosis of disease, weakness, lethargy, and all such things. And it is actually, I think it's a nightmare for all of us that if we deal with such vague presentations. The list of differential is very long. There is overlap with psychological causes. And these conditions, the lethargy, weakness, the aches and pains, they all affect our daily life. So even if the cause may be very minor, but the impact is very major. So let's make some strategy, some ground rules, how to proceed in such conditions, and how to proceed in this presentation. How I'm going to take you along in this small brief presentation about such vague terminologies. So the first thing, let us discriminate between these symptoms, like what is weakness, what is lethargy, what is fatigue. Let us define them, and let's understand the basic pathophysiology of these non-specific complaints. And let us make a simplified list of differentials. List of differential may be very huge, the size of a newspaper. But let's make a simple thing so that it's easy for us as family physicians to reach to an appropriate diagnosis. I especially chose this picture of a ladder. That's how we should make our approach: history, physical exam, and those. And according to this ladder, let us set our objectives of today's presentation. And by the end of presentation, I think all of us should be able to take a relevant history of these complaints, perform a relevant exam, and order relevant tests, and identify those who need referral. This is my picture. When you start to defining these terms, you are like this. Weakness. By definition, it's a reduction in the strength of one or more muscles. But remember, today we are dealing with generalized weakness, not localized weakness of one arm or one limb or one foot. So if the symptoms are localized, it is easier to diagnose. Today we are dealing with generalized things. And the important about weakness is mostly a symptom. And it can occur with any disease. But sometimes the weakness may be objectively assessed by clinical examinations. So there are diseases which cause generalized weakness. I think the point is that mostly it is a symptom. The patient complains of weakness, but we can also assess weakness objectively. The objective weakness, that is when you find some evidence for the diagnosis or you have some clinical findings, are usually caused by metabolic conditions, neurological conditions, primary muscular diseases, and toxic disorders. Can you make camera रोक लेना थोड़ी देर? Unfortunately, the details, the examples of these conditions were not saved. So, but we can discuss these, like metabolic causes. We all know the most common one is diabetes, chronic renal failure, chronic active hepatitis, thyroid disorders, they're all metabolic conditions which can cause generalized weakness. Neurological causes like multiple sclerosis, in which there is demyelination, there is generalized weakness. Myasthenia gravis, primary muscular diseases like dystrophies, in which there are weakness of the girdle muscles, and there's a loss of muscle bulk. And toxic disorders like drugs, like poisonings. The other common symptom is fatigue. Everybody gets fatigue. Yesterday, because of we had one-day course, MRCGP course, we all were fatigued. But this does not mean that we all are sick. Fatigue is a subjective feeling of weariness, tiredness, lack of energy. It's different from weakness. So, your question is the classification of acute, subacute, chronic. I have one slide for this, and a part of answer to part of your question is when fatigue is not relieved by enough sleep, good nutrition, and low stress environment, it should be evaluated. So let's discuss the fatigue. What are the causes of fatigue? Like common causes are physical exertion, very common. Family physicians work so hard, they all get fatigue. Emotional stress, boredom, lack of sleep, these are common causes. So most of the common causes of fatigue are because of these conditions. However, some of the diseases are those psychological diseases, organic disease, any disease in initial stage or before any symptoms can cause these things, fatigue. And when it is not relieved by enough sleep, and you see that the patient has enough sleep, good diet, no stress, even then there is a fatigue, then you look for causes. And the duration of fatigue is divided into three parts. Like the recent onset is within 1 month, prolonged is 1 month to 6 months, and after 6 months it is called chronic disease, because there are diseases like chronic fatigue syndrome, in which there is fatigue for more than 6 months, and the definitive criteria for chronic fatigue syndrome, the cause is not known. And how to differentiate between different causes of fatigue? We need a good history and good physical examination. This is a simple slide showing the criteria for chronic fatigue syndrome. We will not go into the detail of chronic fatigue syndrome. We just remember that there is a special syndrome, chronic fatigue syndrome, and there are specific criteria for them, because the etiology of this is not known, the exact etiology, and the response is also variable, and it can go on for years. Important, when we are talking about the causes of fatigue, let's remember one thing: the most common cause of fatigue, what is it? Like in a study in United Kingdom, or in the general practice, a person found that there was no physical cause of fatigue in 62% of patients. It's a huge number. 62% of the patients have no obvious cause for fatigue. It is usually associated with sleep disturbance or stress. So the point to emphasize is there may not be an organic cause of fatigue. There may be psychological causes, stress, or environmental causes, lack of sleep, stress. Common factors or causes which can cause fatigue. Let's list them to see that how lengthy the list is. Like in lifestyle, some drugs and alcohol abusers, sleep deprivation, overwork, burnout. We all get overworked and burnout. Sedentary lifestyle. If you are not active, you are not exercising, you are bound to be lazy or bound to have fatigue. Inappropriate diet in which there is micronutrients are deficient. Social bereavement or grief, or somebody in the family dies, you are so upset that you feel fatigue. Occupational stress, including bullying. Dr. Saif will be happy. Where is Dr. Saif? He calls me a bully. Unemployment, again related to stress. Psychological causes, anxiety, depression, and sleep disorders, all of them. Physical causes, drugs, antihypertensive, infections, anemia, cardiovascular. So this is a long list of diseases. Just remember, any condition can cause fatigue, but the most common cause is stress, and psychological. This is one picture I found. So people are thinking that this is bush fatigue advisory committee something. This is just a joke that he says that every good thing is done by him and every bad thing is done by Clinton. When you talk about organic causes of fatigue, we're not talking about psychological, the organic causes, the medical causes. So let's see which are the medical causes which cause fatigue. Like any infection, bacterial endocarditis, congestive cardiac failure, diabetes, chronic liver disease, Addison's disease, anorexia and other eating disorders, arthritis of any kind, autoimmune disease like lupus, rheumatoid arthritis, malnutrition, cancer. So if you look at the list, there are diseases of cardiovascular disease, endocrine, liver and kidney, again endocrine, eating disorder, psychiatric, joints disease, autoimmune, again joint and muscle tissue, malnutrition, cancer. Some people use stimulants for relieving fatigue. In the short term, the person may feel energetic by using stimulants, caffeine, high dose of caffeine or stimulant drugs, but in the long run, these things do not help. There is some medication which can cause fatigue, and these are antihistamines. We know that antihistamines have anticholinergic side effects. They can cause dry mouth, drowsiness, weakness. And blood pressure medicines, all of them can cause fatigue and weakness. All sleeping pills, steroids and diuretics can cause this. This is not the most important effect of statin, but it causes muscle weakness and the hepatitis, and that can lead to. But remember, it can cause by any drug. These are the common ones that affect cardiovascular system, the CNS. They cause more weakness. Let's skip that. This is one diagram which is self-explanatory and gives the relation between different symptoms. Like if somebody has pain, and how he perceives that pain depends on his beliefs and attitudes, his psychological mind at that time. He may be anxious. If you are anxious and depressed, you can feel the pain more. If you are relaxed, you may be feeling less. And illness behavior, how you have been brought up or how you behave to your illness. So you might have seen two people with similar type of disease. One may be very upset, depressed and complaining about things. One may be relaxed and not complaining. So the behavior about illness also matters, and there are social things. Let's talk about weakness and fatigue, how to approach. If we talk about weakness, then we should take details of weakness, like when did it start, is it worse in the morning or in the afternoon, the associated complaints, which side of the body, it's a generalized or localized, aggravating factor. Like if it's a stress aggravating factor, the most likely cause is psychological. If work, exercise, use of muscles, so you think of organic things. So the details of weakness is important. Then you search for organic causes. You try to localize the cause. Any respiratory cause like cough, sputum, fever, weight loss. Thinking of tuberculosis, causes of hepatitis, it can cause weakness, fatigue. Urinary tract infections, diabetes, endocrine problems. You ask about symptoms of thyroid disease. You ask about symptoms of diabetes. Try to localize, try to find out the cause of weakness and lethargy. Then you also look for psychological causes. We know that the psychological causes also cause weakness and lethargy. Plus, if you have some disease like diabetes, hypertension, these diseases, the knowledge of having these chronic disease can cause anxiety, depression, and psychological stress. So both of things may be present together: the organic cause, the psychological cause. So the approach is detail of history, weakness and fatigue, search for organic causes in history and examination, and search for psychological causes. There are two approaches. Like if you talk about specialists, they usually they take weakness, then they try to rule all organic causes. They start they write so many tests, try to rule out organic disease like diabetes, thyroid, liver test, X-ray, ECG, ultrasound, and vitamin B12, folic acid, nerve studies. They write so many things. They are trying to rule out diseases, and then when there is no cause, then they declare it as a psychological cause. This is not related to us. This is now the patient is referred to a psychiatrist. While in family medicine, like in family physicians, we screen for organic diseases through history, physical exam, and some tests. We screen for common diseases, and then we treat common organic causes and psychological causes together. We are not like specialists, like they step by step rule out organic and then go to psychiatry. The family physicians treat both the conditions, the organic and the psychological causes together. What is it? A family physician sleeping on the desk or a student sleeping on the desk? This is a student, a fatigue student. When this student will grow up, may turn up to become a family physician and maybe sleeping, I think. Let's look at the pathophysiology of these vague conditions. Number one, cardiovascular system. So the key is all the organ systems that are generalized can cause generalized things. Like cardiovascular system, if the disease is hypertension, congestive cardiac failure, then the weakness may be present. Nervous system, you see the nerves are brain, spinal cord, nerves are all around. The neuropathies, the multiple sclerosis or myasthenia gravis. So the generalized things can cause generalized weakness. Again, the nervous system also contains autonomic system like sympathetic nervous system, parasympathetic nervous system. Look at the distribution of all these. Like this applies to the salivary glands, heart, lung, gut, liver, the adrenal gland, the bladder. So all the parts are supplied by the nervous system. So the weakness of the nervous system can cause, the neuropathies can cause weakness. Endocrine glands. We have so many endocrine glands, but the common one to remember is thyroid gland, parathyroid glands, adrenal glands, which can cause weakness. So thyroid and adrenal are more important. Musculoskeletal system. Look at the complexity of musculoskeletal system. Bones, the tendons, the fascia, the muscles, and the delicate arrangements all over. Those diseases, the autoimmune diseases, or the which are generalized to the musculoskeletal system, myositis, SLE, rheumatoid, they can cause weakness and pains. And last but not the least, the most common cause, stress, depression. So there are so many causes. Let's make a simplified list of differentials. So we remember that these weakness, fatigue, lethargy, aches and pains are symptoms, they are not signs. They can be associated with any illness. If you have pain in the toe, infection in the toe, the infection can spread, there may be fever, body aches, anything. So these symptoms can be associated with anything. But remember, if there are localizing signs and symptoms, it is easier to diagnose. When there are no symptoms, then you are at sea, then you look for the cause, and you may not find the cause for weakness. And here comes the important point. I have discussed this point earlier. What is the difference between disease and illness? Do you remember what is the difference between disease and illness? Anybody? This is key concept, a difference between disease and illness. Disease is the pathological process, but what the patient is feeling, his suffering, this comprise the illness. Disease may be small, but the illness may be big. or vice versa. The patient may be having a big disease, a malignancy, the illness may be small, may be relaxed, the patient may be relaxed. So how you take your disease is illness. And it brings us to the biopsychosocial model of managing a patient. Keyboard is not working. क्या हो गया? तार नहीं गई. Between disease and illness, and it's important to remember this difference. And the differential diagnosis fatigue is very broad, but we need an organized approach to identify the key conditions, and to save money. If you start writing tests, you're going to waste so many resources, and you are going to waste time. Again, a summary of the differential diagnosis again. Let's see the broad categories. Physiological causes we just discussed, overuse, exhaustion, stress. Psychological causes, anxiety, depression can cause it. Circulatory causes, hypertension, hypotension, congestive cardiac failure, ischemic heart disease. Endocrine causes, thyroid and adrenal gland. Metabolic causes, diabetes, renal failure, liver failures. Neurological causes, multiple sclerosis, etc. Neuropathies. Neuromuscular causes, myasthenia gravis. Muscular causes, the dystrophies. Autoimmune disease, rheumatoid arthritis and SLE. These are the common things to remember. Nutritional causes, vitamin B deficiencies which act as coenzymes, micronutrients deficiency, iron deficiency, drugs. So let's go step by step. Sorry, I lost the formatting and animation of this presentation, this slide, and because there was an electric breakdown. So we take these non-specific symptoms, which are weakness, lethargy, fatigue, etc. We ask for specific symptoms, trying to localize. We ask about respiratory system symptoms, gastrointestinal, the liver, the kidneys, the gut, the colon, the bladder, the headache, eyes, vision. You try to localize the cause. If you're lucky, you can find the cause. You may not find the cause. You try to differentiate between organic and psychological causes or factors, because they may occur separately and they may occur together. So try to differentiate. We have to deal with both. Or order age and sex appropriate tests. Like you don't write prostate specific antigen for a female or breast exam for male. Like age, there is diabetes, you write in the middle age people, or in the elderly you look for malignancies. So age and sex are important to remember when ordering tests. And then you have three options. Either you find the cause which is very severe and serious and need referral directly, you refer it. There may be a test where you find clues, like if you find electrolyte abnormality of liver function test, for instance, then you go a step higher and investigate more to reach to the cause. So the second step is you try and investigate yourself, the patient, and then there may be a situation where you find the cause, the patient is in your control, you are dealing with both the organic cause and the psychological causes. Just to give you an example, you can have a patient with anemia, depression, you treat both. How to localize in history, physical exam, and non-verbal cues. The posture of the patient, the facial expression of the patient, how he expresses himself or herself. So all the non-verbal cues, the history and physical exam. How to differentiate between organic and non-organic causes. You diagnose organic causes. As family physicians, we try to diagnose organic causes and diagnose psychological causes, both of them. So ignore this. These are errors of formatting, these two boxes. It's again error of formatting. Let's understand the relationship of psychological and the organic causes. Like organic causes can cause psychological stress, and psychological stress like depression, anxiety. We know that symptoms of depression: weight loss, lack of sleep, lack of libido. So there are other symptoms associated with anxiety and depression. Anxiety, you have tremors, palpitation, sweating. So this is not causes, this is organic symptoms. So psychological causes can cause organic symptoms, organic causes can cause psychological symptoms. So both aggravate each other and we have to deal with both of them. Just to give one example, like if the patient has diabetes, let's understand it. Diabetes we know that can cause weakness because of hypo and hyperglycemia. Diabetes can cause weakness because of infections. Diabetics are more prone to infections. Diabetes can cause weakness because of renal failure. Renal failure can cause anemia. It can again cause weakness. And having diabetes can cause depression. So the one disease can cause weakness in so many ways. How common are these symptoms? According to World Health Organization data, these symptoms, the psychological symptoms, are very common and they are present in all countries and all cultures. And half of these patients remain disabled by their symptoms a year after presentation. And the outcome is worse when these are referred to secondary or tertiary care. This again emphasizes the role of primary healthcare physicians. So how to investigate? There are two goals of investigating these patients. Number one, to rule out serious causes like malignancies, severe infections, organ failures, and common underlying causes like diabetes, anemia. A major obstacle to effective management is patients feeling disbelieved by their doctor. Patients who present with symptoms that are not associated with disease may be thought by some to be putting it on. It's very common. The treatment goal is to improve coping and functional rather than eliminate the symptoms completely. And the one approach is listen more and do less. And this is, we are talking about weakness and lethargy because of psychological causes. This is again a paragraph. The formatting has not been saved. The animation has not been saved because of the electric failure. We are talking about aches and pains. We remember aches and pains are conditions where the generalized pain all over the body. So there are conditions which cause this. Number one, any bone marrow disease like leukemia, bone marrow infiltration, and it can cause aches and pains. Rheumatoid arthritis, SLE, all the autoimmune diseases can cause aches and pains. We know that, like polymyalgia rheumatica is autoimmune disease, temporal arteritis, SLE, myositis, rheumatoid arthritis. All of them can cause aches and pains. And the one important cause of aches and pains in the growing child may be growing pains. It is very common and we need to differentiate this. Why we need to differentiate, investigate a growing pains? Because there is a possibility of underlying disease. So that's why we do CBC, ESR, and X-ray of the aching limb. Treatment is very simple of growing pains: massage, application of heat, and use of non-steroidal inflammatory drugs. Reassurance and explanation, all such cases. And there's difference between how to explain to the patient and reassure by explaining. As reassurance does not mean सब ठीक है, बस ठीक है, मुझे समझ आ गया, आपको कुछ नहीं है. The patient will not take it. You have to explain on scientific basis. Just to give one example, don't look at the transparency. Suppose you can explain that a patient has multiple symptoms and you know that he is depressed, and the patient is concerned about organic disease. Then you try to explain that you know that brain controls our mind, our body, our heartbeat, our muscle weakness, everything. When your brain is stressed, everything gets disturbed. That's why you are getting the pain in your muscles, you are getting dyspepsia, you are getting your bladder is upset, your gut is upset. So these are causing this. And you explain that Yes, you are right. There are diseases which can cause these symptoms, and we will investigate those. You also write some tests to reassure the patient, to rule out the organic disease, screen for organic disease, and then you explain to the patient that you see the tests are normal, and we think that is psychological cause behind this, and the reason of psychology is that brain controls everything, and you can then prescribe drugs. Otherwise, if you just simply say कि बस अब ठीक है, आपको कुछ नहीं है, patient will not take it. So again, non-formatted. Sorry for the bad slides, because I lost all the formatting in the last moment. Principles of treatment. You explain to the patient that symptoms are real. The patient, if the patient has psychological symptoms like psychological pains, dyspepsia, their symptoms are real. There may not be organic cause behind them, but symptoms are real. You must acknowledge those. Provide a positive explanation and offer opportunity for discussion of patient and family's worries. Give general advice on coping with symptoms, encourage return to normal activity and work, identify and treat depression, anxiety, discuss and agree a treatment plan, and follow up and review. So, if we understand the relationship between biological, psychological, interpersonal and medical factors in the predisposition, precipitation and perpetuation of functional somatic symptoms, allows convincing explanation to provide to the patients and effective treatment to be planned. So the idea is to understand biopsychosocial aspect of disease, and the challenge for us is to diagnose such disorders quickly without over investigating. This is my last slide. Sorry, I have made 2 MCQs for you. I've lost all the 2 MCQs. This last slide is just saying, explaining that family physicians are too busy. They see 300, 400 patients in a day, and one day there is 600, 700 patients. The family physician will have a stethoscope put on 3 patients at one time. So don't do that. Give proper time to all patients. And thank you for your listening. I am sorry I've lost so many formatting and 2 MCQs which I made for the practice.
What did you diagnose in this case?
MCQ. You are sitting in your clinic, and a 67 years old female comes to your clinic with complaining of generalized aches and pains, weakness, lethargy, and the pain is more on the shoulder and hip area. She is depressed during this period, and she has difficulty in getting out of the bed early in the morning because of stiffness. Okay. Her rest of history is normal, and rest of examination is normal. Okay, let me repeat. A 67 years old lady comes to you with aches and pains, fatigue, weakness for 2 months, and she has stiffness which is more in the morning, and she has difficulty in getting out of the bed. Okay. Rest of history in physical exam is normal. Her labs are, just remember, sugar 102, SGPT 25, creatinine 0.9, ESR 87, urinalysis normal, TSH normal. So how the question will be, how will you manage this patient? Yeah, which drug will you prescribe? Also ask the options: NSAID, steroids, paracetamol, vitamin D, calcium. Which one? 5 options: steroids, NSAID, vitamin D, calcium, and paracetamol.
Calcium and paracetamol.
The one, you have to choose one drug. So have you understood the scenario? Elderly women with aches and pains, with depression and stiffness, which is more in the girdle areas, hip and shoulder, raised ESR. What is the common diagnosis? Rheumatoid arthritis will be more on the peripheral joints, stiffness of joints, not in the shoulder girdles. Osteoarthritis with knee joints and elbow joints or backache. There are clues. Something autoimmune because there is stiffness, something generalized, say hip and shoulder girdles, that gives you a clue. Have you heard of condition polymyalgia rheumatica? Say this picture goes more with polymyalgia rheumatica, and if you look at the options, myositis will cause aches and pains in the muscles, it in the girdles. So polymyalgia rheumatica, if you think of polymyalgia rheumatica as a possible cause, because one of the look at the diagnostic criteria, females more than 50, ESR more than 50, I think aches and pains and stiffness which is more in the morning. So the diagnosis is polymyalgia rheumatica, and the treatment of polymyalgia rheumatica is steroids. So out of 5 options, we then take steroids. Although steroid looks, steroid तो कभी लिखनी ही नहीं है, but steroid is the treatment of choice for polymyalgia rheumatica. Steroid patient gets better in 24 hours. The magical treatment for polymyalgia rheumatica. This is one MCQ. The other MCQ maybe, if we are not running short of time, 3:30. So the other MCQ, we are 26 years old woman comes to you. I made all these MCQs and I lost so many formatting. These slides were not right. I lost the actual presentation. So 26 years old woman, housewife, comes to your clinic with complaining of weakness, lethargy, pain in the shoulders, arms for 6 months, and her husband is a driver, and her mother-in-law is bedbound because of stroke. She has 5 children. Think okay, and rest of history and physical examination are normal. She looks pale on examination. That's it. Her hemoglobin in the last pregnancy 2 years ago was 10. See, let's repeat the scenario. As 26-year-old female with 5 children, husband is driver, mother-in-law is bedbound, complaining of weakness, lethargy, pain in the shoulders and fatigue for 6-7 months. She was anemic 2 years ago. That's the only report you have. So this is the scenario. You can get the same scenario, very similar scenarios in MRCGP. So hemoglobin was 10 2 years ago. You have not checked it. So the options will not be straightforward. Okay, what is the cause? What is this? Option will come as steps of management. Like one option may be option number 1. You reassure the patient, counsel it, dietary advice, posture advice, give iron therapy. So this So this is one option. Combination of postural advice, dietary advice, reassurance and counseling, and iron therapy. This is one option. The other will be advice, calcium, iron, multivitamins. Third option may be the dietary advice, postural advice, counseling, iron therapy, family planning. The fourth option may be something similar like this. So there may be steps of management. I don't remember the fourth and fifth. Let's take 3 options. Number 1, let's simple one. Giving iron, calcium and minerals. This is one approach. Counseling, dietary advice, posture advice, iron therapy, maybe paracetamol. The third may be dietary, posture, counseling, paracetamol, iron plus family planning. I think, although you get the trick of the MRCGP, so they will go a step ahead. They will not ask for the factual knowledge. They will ask a step ahead. What is the management? They are checking how you apply your knowledge, how you analyze the scenario, and what is your approach. The other important thing about MRCGP MCQs is that you don't have to think of ideal situation, ideal treatment. You have to choose between the 5 options available. Which one is the best option? don't get biased by, oh, all 5s are not the ideal. All 5 may not be ideal, but which one is the best among all these 5? So this is the trick of MRC questionnaires, and they are checking how you apply your knowledge. Like in this case, this is scenario of weakness, lethargy, and excess. This family planning is one important thing, which a family physician will never forget, because she has 5 children at the age of 26. I'm saying. Any other question? Okay, thank you. Let's have a. So I think.